Dr. Shan, welcome to the show.
Hi, Dr. Vic. Thanks for having me.
I'm excited to have you on and dive deep. I know we've already had some great conversations in the past already, and I was just like, I know we're going to have many more. And so I was really looking forward to this moment and many more to come. So, listeners, there will be many more than just one. Dr. Shan, as you'll know, has a wealth of knowledge. And a lot of times, I will say this, a lot of times, sometimes PTs and chiros don't get along. And it's not whatever that reason is. I love what
Mhm.
you're up to and what you're doing, and I'm just for what I do, and it's just like, oh, this is someone who I'm happy we're in the same town and we're practicing and doing what we love. And so, before we get into all that good stuff that we're going to get into today, tell me a little bit about your story. How did you get into what you're doing, and why did you go and specialize into peds, especially at 0 to 1 year mark and so forth?
Yeah, absolutely. So I knew from a really young age that I wanted to work with babies. I think I was 6 years old when I told my mom I wanted to be an obstetrician. I didn't know that obstetricians don't get to play with babies. They just touch them and hand them off. So, as through high school and through college, I decided I wanted to be a physical therapist because I love the way that the human body is capable. Um, of so many things. And so when I found out that I could combine my love of babies and physical therapy and movement, um, PT was just the way to go for me. So I went to ETSU for undergrad and then for PT school, and then immediately dove into the pediatric world. It wasn't until I had my daughter and then my son that I realized that there is such a need for physical therapists in not only early intervention, which is 0 to 3, but specifically for those babies that are 0 to 1, 0 to 6 months old. So catching babies with tongue ties and lip ties, catching those babies that are born with asymmetries so that we can fix it super early instead of waiting until they're 2 and 3 years old and then trying to backtrack and redo everything that they've learned. I realized then that I wanted to be in that super early stage of working with babies.
I love that. It's similar. That's kind of what happened in not my journey as like early on as yours, but that interest into, pediatrics 5 years into my practice, all of a sudden I was just like seeing and learning about when the architectural part of the brain like hardwires to a certain degree. And it's not like you can't change certain things, but it's like there's this foundation. It's like the foundation of a house. It's just set. You can't, unless you break the foundation. That's just what the foundation is. And I
Right.
was like, so wait a minute, you're telling me after the age, so it's like after the age of 2, I'm like, I'm just working with I'm just working with symptoms of the nervous system from that moment on. They're like, pretty much that's what we know now. And I was like, I don't like that. No, that I need to make a
No.
change. And it's fascinating on, the work that you do and the work that when you get that early on, how important it is. And that's the next question I want to ask is like, why is it so critical to, early on, sooner the better, um, to get changes going rather than, oh, they're young, I'll wait till they're a little older and we'll take care of it then?
Right. So you already touched a little bit on it, is that, 0 to 2, their brains are changing and making their foundation. So the sooner you can get in there, the better. I'm going to give you an example using Torticollis and Plagiocephaly. That one is one of my favorite diagnoses to treat. So Torticollis is when the right or left neck muscle gets tight and short. So they have a head tilt to one side. And then it gets so tight that they will want to look the other way. So imagine so I'm sitting in my car right now. Put your left ear towards your left shoulder and then turn your nose up to the sky. These babies that are either born like this because it's a positioning in the womb, if it's a birth trauma, or if it's something that happens in the first couple months of life. So they're using swings and strollers, containers all the time. When these babies get stuck here, the back of their head is going to get flat. That's the plagiocephaly part. So that's the head shape. Torticollis and plagiocephaly, if you can get that baby into a PT within the first 0 to 2 months of life, it's only going to take 2 to 4 months to correct that head shape and to correct that muscle imbalance. If you wait until that baby is 6 months old to a year old, it's going to take up to a year of physical therapy to get that muscle imbalance figured back out. And then you've missed the PT window for head shape. So you're going to have a helmet to fix your baby's head shape. So if you can get this baby in super early, you have to do less work to figure it out. And you say, well, my baby has a wonky shaped head. That's fine. They've got hair, it'll grow. My response to that is, yes, the hair will grow, but does your kid want to ride a bicycle or play football or join the military and need to wear a helmet that fits their head so it doesn't pop off if they get hit or fall? Yes. Does their brain need to develop inside of their skull so that they can function and use their brain optimally? Absolutely. So if we can fix the head shape, fix the torticollis, 0 to 4 months old, 0 to 6 months old, you're going to prevent some of those lasting effects down the road.
Yeah, it's so interesting on all those things because like even with like you're talking about head shape, and I do a lot of cranial work with kids to shift things or change, if they're hyperactive or there's different centers of the brain that we can stimulate. One of the things you're bringing up is like, okay, kid has a wonky head. They have a wonky head and hair is going to cover, but guess what? There's tissue under that skull and blood circulation that doesn't move well. So those certain areas of the brain won't develop properly. And they did this back when I studied cranial work. I was amazed that the Mayans, we're talking what, 1800 years ago, 500, 400, 500 AD. They knew this principle because if you were a priest, you would have more of a cone head. They would actually shape your head to be a cone.
Yeah.
If you were a scientist, they would square the head off. And I was like, get out. They knew that back then. And then of course, my neuroscience background, I looked and I go, what centers of brains do this? And when we flatten this, what happens here? And I was like, holy cow. They knew something.
Yeah.
And so the point is that there are centers of the brain that we will not, with a misshaped head or even with, torticollis that will create the plagiocephaly and all that, it will play a huge role. And it's even in my experience, I've had kids where 6, 8 months, I had this one kiddo, he just had a really big head. And the mom was like, look at this. There were twins. And you see the brother, I look at the brother and I'm like, I see who took all the nutrition here because the brother was the little guy, he was he was like half the size and they're twins. And it was so cute, but the big guy, the bigger brother, he just had severe torticollis. They're looking at doing surgery. When the mom came to me and was like, "Hey, we're doing the PT, we're doing this, we're doing that." A friend of mine told me about you, and she's like, "I heard you can help." And I said, "You know what? We're 6 months in." I said, "You're gonna have to give me at least 3-6 months is when we can. You're doing everything else. It's just this is really severe." And so I'm like, it's going to take a little time. And it took us about 4.5 months, give or take roughly. And his head was perfectly fine. Got it centered. But again, it's that conjunction work because like I can get to the neuro side and help with that.
Right.
But then we still need those musculature work to help so that if there is conditioning, especially the older they get, there's a lot more conditioning, as you know, with that. So where can, when it's all becomes the process of starting, like what's the simplest things then, parents should, focus on that we can, can help neurodevelopment, and what's that first step?
So the first step is going to be doing tummy time. And every parent everywhere has heard, do tummy time, right? So a little bit of background is that in 1992, which was the year I was born, the SIDS information came out, the Back to Sleep campaign started. So in 1992, everyone started sleeping on their back. Because of that, we needed to spend more time on our belly while we were playing. One of those reasons is because of our head shape. So if we're sleeping on our back for 23 hours a day, you're going to get a flat spot on the back of your head. So if we're playing on our tummy, we can help counteract that head shape issue. I think the statistics in 1992, it was 1 in 300 kids had an altered head shape. And now in 2024, it's 1 in 4. So it has jumped a lot because of, what came from the Back to Sleep campaign to keep our kiddos safe while they're sleeping. So tummy time is important not only for head shape, but for that first foundational piece of movement and development. So when you're on your tummy, not only are you learning how to lift your head, you're learning how to use your pec muscles to pull your shoulders in so that you can start pushing up on your elbows and start pushing up on your hands to learn. When you're in tummy time, doing tummy time, you're learning how to rotate your head left and right to clear your airway. You're pushing on one hand to get a weight shift so you learn how to roll over. You're strengthening your glute muscles and your ab muscles so you can pull them together and coordinate those things for crawling. So tummy time is really that foundational piece of movement for later on.
I love that, and it's so true because even from a chiropractic side, it's the beginning of curve correction, or not curve correction, developing the curve in the neck, which is so critical.
Yes. Yep.
And I remember I was in my P class and taking my certification, and the instructor just happened to be one of the instructors I had in school for like half my time, and he's like the hardest. He's just, nobody liked him. I didn't mind him. He was a little very rough around the edges, but he's a genius. And I remember he pointed at me and he goes, "Okay, Dr. Manzo," he's like, "tell me, why is tummy time important?" I was like, "Well, development of the curve." And he's like, "Yes, but why do you want to do that? What is the importance?" And I'm like, "I don't know, stimulate the nervous system so that you can go ahead and, I'm just like thinking off the top of my head. And I'm like, and he's like, "The thing is he goes, you're pushing pathways to give the opportunity. So when the brain gets to that center of development, then the muscles are ready to go. The nerves are there to fire, and then they'll start to developing that curve." And I was like, okay, so it's not curve grading the curve. He's like, "No, it's the foundation for the curve." I was like, sounds like semantics, but I'll go with it.
All the things.
Yeah, it's one of those things, but it is so crucial in just so many ways. I love how you brought it up because it's like you get that part right, and it leads to everything else. I used to love working with patients, and they'll show me they'll say, I'll tell them that your head has a head tilt, and they're like, "I don't see it." And if they're a little older and have some hair on the back of their head, and they're like 3, 4, 5 months, I'll look and I'll say, "Look at the back of their head. Now, you see that little line, that little space back there? You probably see this all the time."
All the time.
And I'll be like, right? And I'll be like, "Why is there more hair on the left side of the head in the back, but the right side's kind of bald?" And they're going,
"Yep,
"I don't know." And I'll say, "Well, let's come back around and let's look. Now look where the head tilts. Now if they're laying down, I kind of show them they're going to favor this side versus that side."
Yep.
And well, that's one of the reasons why. Or if they're rolling, right? Because I want to get into some troubleshooting here in a second. Like even rolling from side to side, it's like, I'll always tell parents, I'm like, they go rolling on that side, they don't roll on this side. And they're like, "How do you know that?" I'm like, "It's just patterns. This is what they're going to do." So what are some great ways for people to start doing tummy time? Because there's so many things out there. Google is great, and it's just information overload. So what are some simple ways that parents can start to say, "Hey, this is how we're going to do tummy time. This is a great way to initiate it"?
So my favorite way to start tummy time is just on your chest. So if you, mom or dad, this is a great time to do skin to skin. As a breastfeeding mom, you can do tummy time even while you're breastfeeding, right? So if you're sitting in a recliner, you can place them on your chest and then you have to lean back. So the point of tummy time is that they have to be able to lift their head against gravity. So the further you're reclined back, the harder it's going to be, the more effective it's going to be. This is also a great way for oxytocin release, right? Because if you're skin to skin, that touch, the love that you're getting, that skin to skin also is comforting for baby. So when you're on your belly, and Dr. Vic, you can talk more about this, you get your vagal nerve stimulation to help decrease that fight or flight response to tell each other that you're safe, right? So my favorite way to start is just doing it on your chest.
I love that. And I like the whole recliner thing. And I love how you're tag teaming some other things like oxytocin and stimulating that while you're doing tummy time. I love when you can add things into the mix while you have to do one thing. Why don't add multiples to it?
Right, absolutely. As a mom, I know how busy it is to try to do all of these things. And especially if your kid has a tongue tie and you've had it released and you're trying to do stretches and exercises, um, and if you've got more than one kid at home, you're not just getting to spend 100% of your day with baby. You've got other things going on. So my big tip for tummy time as well is to put it into your routine during your day. And my favorite time to do that is every time you change their diaper, roll them onto their belly and let them hang out there. If they only make it 30 seconds before they start screaming, then hey, they made it 30 seconds, and in another 2 hours, they're going to be awake, need another diaper change, and you can try again. So you can do this 6 to 8 times during the day so that they're getting more and more exposure. They're going to recognize that tummy time is part of their routine, and you don't have to think about it. You can just say, oh, I'm changing your diaper. I'm going to roll you over and let you sit here for a minute.
I'm a huge fan of implementing things in throughout the day, and I think that's great because a lot of times, sometimes parents will be like, "Yeah, I'll be had you practice tummy time. How's it coming along? Oh yeah, we'll do it. We'll do it once a night at this time." And I'm like, I go, we need a little bit more stimulation than that. And they're like, what do you mean? I'm like, it's great with the diaper thing. I was always just like, after before, you just find the time to do it throughout the day. But the diaper is a great one because it's like, oh, it's easy to remember. You link diaper, tummy time, diaper,
Right,
tummy time.
right,
After a couple of days, you're gonna be
absolutely.
like, this is what we do. And for development of the brain, just our brains in general as adults, we love routine. It calms the brain. Regardless if
Right.
you like adventure and you want to be spontaneous in life, that's all great. But from a neurological perspective, the brain loves routine, and for babies, it's so crucial to have routine. So I think that's a huge thing easy thing to implement, and so much more. What are some things
Absolutely.
that then, let's say, we got a mom here listening, and you got a baby, and there's just tummy time isn't going well. It could be maybe they have a little bit of torticollis, or they just have an imbalance in the neck, or what are some troubleshooting ways that things that come up, and how can they troubleshoot it to help get that kiddo to have that tummy time so they could get that whole neural development?
Right. So some kids, if they have an asymmetry, if they have a tongue tie that's kind of keeping their necks scrunched up into their shoulders scrunched up into their neck, a lot of times these babies also with reflux, they're going to just hate tummy time. It is not your job to push them and let them scream the whole time. Okay. If they make it 30 seconds, they've made it 30 seconds. If if your baby doesn't want to lay flat on the floor, they don't have to lay flat. You can prop them up on the boppy pillow. You can prop them up on a little ramp with a little water mats or over your leg so that they're getting a different experience while they're still on their tummy. One of my favorite ways to do this is if you sit in the floor and you put baby up on the couch, you can be eye to eye with your baby in that position. Babies love faces, whether that's mom, dad, the kids, the siblings, the dog, the cat, whatever. Babies love to watch faces and facial expressions. And if you're in tummy time, singing songs, clapping your hands, showing contrast cards, all of those things are going to help entertain your baby so that it's a pleasant experience for them and for you as well, because you and the kids are getting to spend quality time together while trying to get baby to enjoy tummy time.
I think that's great. That's one of the advices I give a lot is like, you got to make it entertaining. And we used to do it a lot with our daughter where eye level, contrast cards, the black and white, and all these things. And then I would always tell, we do this with adjustments. So if I'm adjusting an infant or something along that nature and mom's breastfeeding, it can be formula fed too. It's just there's that oxytocin connection that happens for mom and baby with
Yes.
the breastfeeding. And that's where I'm trying to really hammer in on. So I'll tell them if they're coming for an adjustment, I'll be like, hey, make sure they haven't been fed. And then you bring them in. They're not going to be happy probably when I adjust them because they're going to be hungry. I go, maybe if they're not so hungry, like feeding time's almost close to that point, but I adjust them and I said, then we breastfeed immediately after. And it's the same thing with tummy time that I'll do where I'll be like, hey, you do tummy time, have fun, make it exciting. You want to make it entertaining. Once you're done, breastfeed immediately after. And that way it stimulates that reward cycle in their brain. So like, then they start to associate too, like, tummy time's fun, right? Because we're playing fun, we're
Yeah.
making faces, we're making them laugh. I mean, the laughter my daughter would do at like 1.5, 2 months, it was just, she's starting to giggle. And I was like,
Uh-huh.
it was just so fun to do. But then we would do the breastfeeding right after. And all of a sudden she knew she would start to look for it. And I was just like, cool. She's getting excited. And she's like, then we'd be done and we test her out after a while. This is like a month or so in of doing this, a couple months in. And all of a sudden she'll just look like, where's the feeding, when she get tired of it.
Right.
And then we're like, cool, we got to that point. And repetition is the mother of all learning, so it's like the constant consistency of that. And but yeah, I love the eye level thing is awesome, but I just wanted to add that one little piece in there because it's again, just want to stimulate the reward cycle because the brain's learning pain and pleasure all day long.
Yep, absolutely.
What are any other things? So let's say, one of the things I used to recommend too, like if they had any asymmetries, do you do anything or recommend things like turning to one side to favor versus, I'm not saying you do the other side looking. So like they're doing tummy time. And obviously this is more, they've been used to this a little, to where then all of a sudden you'll have them look, we have them kind of do one of these things where they're starting to build both sides of their, the neck muscles and so forth. Is there things like that do you do or to help with also with some of these things, asymmetries and so forth?
Yeah, for sure. So if you notice when your baby's on their belly, if they always want to look to their left, you want to try to put the interesting and fun things on their right so that they're having to use their neck extensors to pull up and then actively move over to look over their right shoulder. When they've got a bit more strength there and they can do that, then you can make it even harder. But if you hold a toy in front of their head over on the left side, and then you can move that toy a little bit higher than their eyes that they're having to lift up, and you can make them look right and left, back and forth to see how long they can hold it. And you'll see that as they get stronger and as they grow, that they'll be able to do that right and left sweep for a longer amount of time before their heads get a little heavy and go back down to the floor there. And then one of the other things to think about is side lying play. So if you're on the tummy, you can just roll them over onto their side so that weaker side is facing the ceiling. So that when they want to look up and find something, they're going to have to bend their neck up to try to find it. So it's all about strengthening the weaker, elongated muscle so we can get that moving. And then we'll go back in to strengthen the weakened, shorter muscle. So that's when it gets a little bit more specific with PT. And knowing which muscle to strengthen at what time and which muscle to stretch at which time. So if it gets a little complicated because there's a lot of right and lefts here, that's when I would reach out to PT and Chiro to see which way is which. So Chiro is going to come in, look at the nervous system, get rid of those subluxations, and then PT is going to come in and tell you which way to stretch and which way to strengthen.
100%. I mean, because like there in Chiro, in our world, we look at just for the moms listening and how common this is for us. Because first thing we call it something called the jet syndrome. I know we've talked about this in the past, but it's where I teach moms like, you look at the jaw and when they're yawning or when they're feeding, usually the time there'll be like a little bit of a moving back and forth of some sort. That's an imbalance or an asymmetry. Then you have the eyes, always going to have one that's a little lower than the other in some sort. And that relates also to the skull. That's why we look at the eyes, we see that we know there's something with the skull going on already that we can correct ahead of time. And then the tonicity of the neck, the symmetries that we've been talking about. And it just plays a huge role. But that whole area for us, most of the time, that C1 is so from just the trauma of labor for what they're going through. Like labor nowadays is a lot more traumatic than what it was 100 years ago, just because women don't move. We don't move. Actually, just women. It's just all of us in general just don't move naturally like we used to.
Right.
Which means now we lose, as the muscular system so well too. It's like, there's certain muscles that need to be a certain way, and we're just not there. I mean, I'm practicing deep squatting, and I started to trying to get my squat better. just so I can get more range of motion so that my brain can be fed
Right,
better. And it's been
right.
I'm like, wow, I can't move well at all. But anyhow, that's a whole nother discussion. But and so it's looking at that component to help. And with the PT side, you get the conditioning effect. And I think that's really where that PT can just really shine and say, hey, body, I know you're getting conditioned this way. We're going to change that up a little bit and
Yep.
help in that process. Um, as always, Doc, it's always a pleasure chatting with you. But before we wrap this up, how can people find you, follow you, all the great work you're doing, and so forth?
Absolutely. So on my website, it's milestones with an S, milestones.tw.com. So Milestones Therapy and Wellness, that is my company. I'm on Instagram and TikTok, Milestones TW, and then on Facebook, Milestones Therapy and Wellness is my page, but I also have a private group. It's Milestones Therapy and Wellness Parents. And in that private Facebook group, we do all kinds of fun stuff. I drop a lot of handouts in there. So I have a tummy time handout, I have a head shape handout, and then I'll do free webinars in there. So I've got one coming up in March that's actually on tummy time and the guppy pose. So how to troubleshoot and figure out all of those things. So it's going to be kind of an expansion of the talk we did today. But I'll have my little baby doll with me so we can have visuals of what I'm talking about as well. But all of that is Milestones TW.
And for all the listeners, I'll have that in the show notes for you guys to get followed up with the workshop and all that great stuff. Dr. Cheyenne, I'm going to mess up your name for a second. Cheyenne?
Cheyenne, you got it. It's
Cheyenne. I
fine.
know. I don't know why. I was like, doesn't sound right. Thank you so much for being on and taking a moment here of your time to just share with all of us here your wisdom, your knowledge, and helping out those little kiddos because, they just need all that support. And if we can get them on the right foot starting off in the beginning, it's such a game changer for the rest of their life.
Absolutely, absolutely. Thank you so much for having me on here today. I appreciate the invitation and the ability to work together with you and not in competition against you.